Hello there, this is Dr. Qureshi again, and today I was thinking maybe we should talk a little bit about cataract. That's something that's asked by me from pretty much every patient. Patients come in, they have decrease in vision, and they're concerned about what's going on. A lot of times it's refractive error that can be fixed with the help of glasses or contacts, but a lot of times it's cataract. And a cataract is a film or cloudiness or fogging in the lens inside the eye. And for that, today I have a little model to show you. This is the eye model I show to my patients, and it's very helpful because they can relate to something that they can see, because obviously we cannot show them what's going on inside the eye. So here's the interior part of the human eye. This is the cornea, and then through the pupil the rays of lights go and make an image through the lens, which is supposed to be clear like that, and they go through the lens into the posterior part, which is the macula in the retina. So that's the route of the rays of lights to go and make an image. Now, in cases where the cornea is clear, there's no dryness, the refractive error is correctable with the help of glasses, we don't have to worry. But in cases where there is a fog or a film inside the lens, that's where we need to take care of the cataract. Now, to remember a few things about who is a candidate for cataract surgery and who's not, that's very important, because a lot of times patients ask that question. Is it covered by my insurance? What is the outcome of the surgery? Because it's still a big surgery, and the best part is, I'm going to start off with this. We can do the surgery in our clinic. So Dr. Lahi is the one who does the cataract surgery, and he has made a surgical center in not just one clinic, but in both clinics. So the patients don't have to go to a hospital setting for that. So that's very important. The second thing is, the cataract has different types. So when a patient comes to me and I have to assess the patient for cataracts, because they say, well, you know what, doc, I'm not seeing as good as I used to. I'm bothered by glare in the bright sunlight. Car headlights or halos around car headlights have been bothering me. Or sometimes my vision is not, the colors are not as vivid as they used to be. That's a classic sign that it's a cataract developing or progressing in its intensity. There are different stages of cataract. There's 1, 2, 3, and 4. 1 is obviously the smaller cataract, and then 4 is more dense or more thicker cloudiness or fogging in the lens. So what Dr. Lahi does is, we have a surgical counselor here. Her name is Allison, and then we have Amy in the other clinic. So we send our patients to them, obviously, to check their systemic health and to get in touch with their cardiologist, just to make sure everything is good in their systemic health. And then Dr. Lahi is going to do the surgery. Through here, I'm just going to tell you the most commonly done surgery, which is known as phacoemulsification. Dr. Lahi is going to make a little incision, the cornea, go through there, put a probe, and go all the way up to the lens. The lens also, remember, has a capsule anteriorly and then posteriorly. In that capsule, the lens is sitting. So I give the analogy of an M&M. So it has the anterior core and the posterior core, and then the jelly, the chocolate part, is the cataract. So he takes care of that cataract. He puts a probe, breaks it into many particles with the help of the probe, breaks it into many particles, and then sucks it out with a vacuum. And then he puts in, through the same incision area, he puts in a new lens in this area so that the fogging is taken care of. And that is known as the intraocular lens implant. And it's amazing, because I can tell you why. I see the post-op cases. Usually we see the cases, and by the way, it's all done on the same day, maybe under 10 minutes. Sometimes it depends on what kind of cataract it is. So after the cataract surgery is done, we put the patients on the drops. A lot of times they are on antibiotic drops, steroid drops. Sometimes they're put on the ointment also. We give them a patch to wear for nighttime. Usually about 1 or 2 weeks they have to wear the patch. They cannot sleep on that side, obviously. They cannot do heavy lifting, and we give them all the written instructions about what is expected and what is not acceptable and what's not acceptable. Okay, now, after the surgery, the patient goes home, they sleep, they can even take a painkiller if it's needed. They come back to see me first day post-op, then 1 week post-op, and then 4 weeks post-op. So why do we see them so many times? Because I remember a patient asked me that question, because other doctors were probably not seeing them so many times, especially when COVID hit us. And I was like, no, we have to see you, because we want to make sure the progression of the cataract surgery is good. Otherwise, if you don't come, we cannot tell you over the phone what's going on, because I have to check their eyes through the slit lamp in order to determine what's going on. If there's a complication, if the cornea looks good, if the lens is in place. Those are the things we have to know. So now let's talk about what I do on the first day post-op. I see them, I check the lens, I look at the cornea, I look for edema, I look for any kind of inflammation, any kind of infection, and I would say 99% of the times, that's a big number I'm quoting, but since I see the patients myself, I can tell you 99% of the times it's perfect. Picture perfect looking lens implant, and that's amazing because Dr. Lahi does an amazing job as far as cataract surgeries are concerned. So I see them one day post-op, then I call them back in 1 week and I check their medications that they're using, and then about 4 weeks later I do see them for a dilated exam and if they need glasses at all. A lot of times if we do a multifocal lens implant, they don't need reading glasses. If we do monovision, they don't need it, or sometimes they may need reading glasses only and not anything for distance. It all depends on what their prescription was to begin with. Now, I'm going to talk a little bit about the types of cataract, just briefly. There's nucleosclerotic cataract, there's anterior cortical cataract, then there is posterior subcapsular cataract, there could be diabetic cataract, traumatic cataract, congenital cataract, so on and so forth. Steroid-induced cataract also. People who are taking steroids, sometimes they can develop cataract if they have been on oral steroids for a long time. So the most commonly seen cataract, which is known as the age-related cataract, is the nucleosclerotic cataract, and that is the one that I see on a daily basis. Mostly the age group that I see this cataract in is about 50s to 60s and above, starting from 50s. But a congenital cataract can obviously appear in a little kid or congenitally, as you already know. Traumatic cataract, yes, I've seen them. So the posterior subcapsular cataract is the one that grows the fastest, and a lot of times patients will come to me for a dilated annual exam, and I tell them, yeah, you have a PSC cataract developing and it will grow fast, so let me take care of it. Let me call you back in like 3 months instead of a year follow-up. They come back in 3 months and they're like, yeah, you're right, my cataract has progressed so much. So I send them for a cataract surgery. So those are the things you just have to keep in mind, what the cataract does to your eyes, and when it's necessary to get it removed, don't delay it, because a lot of times patients ask me what is the best time to remove the cataract, and I always tell them today, right now is the best time, because if you want to see better, why not see better today? Why wait for another 6 months or a year or 2 years? When your quality of life is getting affected, you need to see good today. Don't suffer with that vision, because it's like looking through a fog, it's like looking through a film, and you don't want to look through that, right? So that was about the cataracts, and I already did the video about the gag capsulotomy. Maybe one day I can sit with Dr. Lahi and show you how the cataract surgery is done in our clinic, because that's something that patients really enjoy seeing, and especially during COVID, they're very concerned about going to the hospital, but when they hear we have a surgical center in our office, in our clinic, in the facility, and they will see us back, like, the doctors they're familiar with, they're thrilled. They really feel more comfortable. So we will most likely do a video on that as well. Take care. Bye-bye.